Become an ultrasound technologist, Associate's Degree General Concentration, Vascular Sonography Advanced Technical Certificate ATC, Adult Cardiac Sonography Advanced Technical Certificate ATC. Eastern Florida State College. Our job is to help you get what you want. We offer 4 steps to success. Step 1, Associate's Degree Program, RDMS, Abdomen, and OB credentials. Step 2, Vascular Sonography Advanced Technical Certificate, RVT credential. Step 3, Adult Cardiac Sonography, RDCS credential. Step 4, credits toward a Bachelor of Applied Science degree. 10 things that require 0 talent. 1, being on time. 2, work ethic. 3, effort. 4, body language. 5, energy. 6, attitude. 7, passion. 8, being coachable. 9, doing extra. 10, being prepared. Ultrasound utilizes a scanning transducer that is in contact with the patient's skin. The proper technique in which the sonographer uses to hold the scanning probe is vital. Here, a sonographer is scanning a phantom's adult heart. About our programs: Associate's Degree General Concentration, Associate's Degree, 77 credits, full-time 5 semesters, continuous, American Registry for Diagnostic Medical Sonography, approved program number 110324, American Registry of Radiologic Technologists, ARRT, approved program number 3161, ARRT.org. Commission on Accreditation of Allied Health Education Programs, CAAHEP 110324, CAAHEP.org. Vascular Sonography, ATC, Advanced Technical Certificate, ATC, 10 credits, 12 weeks, summer sessions 1 and 2, the ability to sit for the RDMS Registered Vascular Technologist RVT credential. Approved by the State of Florida SACSCOC, Southern Association of Colleges and Schools Commission on Colleges. Adult Cardiac Sonography ATC, Advanced Technical Certificate ATC, 2 semesters fall and spring, 17 credits, the ability to sit for the RDMS Registered Diagnostic Cardiac Sonographer RDCS credential for adult cardiac, approved by the State of Florida SACSCOC, Southern Association of Colleges and Schools Commission on Colleges. BAS, Bachelor of Applied Science, Applied Health Sciences degree curriculum. The Bachelor of Applied Science and Applied Health Sciences has multiple specializations: Advanced Allied Health, Biotechnology, Biomedical Sciences, Veterinary Nursing plus Medical Imaging, for continuing education of certified and licensed imaging professionals. All specializations are intended to provide graduates with the knowledge and skills to make an impact in the expanding healthcare field. This is an old cartoon of what a sonographer's typical day is like. What is diagnostic medical sonography? It is a perfect blend of art and science. Very operator dependent. Visit sdms.org and read all about it. The Society of Diagnostic Medical Sonography. Definition of the profession. The diagnostic ultrasound profession is a multi-specialty field comprised of diagnostic medical sonography, with subspecialties in abdominal, neurologic, and obstetrical and gynecologic. Diagnostic cardiac sonography with subspecialties in the adult and pediatric, echocardiography, vascular technology, and other emerging fields. Definition of the profession. The diverse specialties are distinguished by their use of diagnostic medical ultrasound as a primary technology in their daily work. Certifications is considered the standard of practice in ultrasound. Scope of practice. The diagnostic medical professional is an individual qualified by professional credentialing and academic and clinical experience to provide diagnostic patient care services using ultrasound and related diagnostic procedures. The scope of practice of the diagnostic ultrasound professional includes those procedures, acts, and processes permitted by law for which the individual has received education and clinical experience. The general sonographer, adult cardiac sonographer, pediatric cardiac sonographer, and vascular technologist are able to perform the following: obtain, review, and integrate pertinent patient history and supporting clinical data to facilitate optimum diagnostic results, perform appropriate procedures and record anatomic, pathologic, and/or physiologic data from interpretation by a physician, record, analyze, and process diagnostic data and other pertinent observations made during the procedure for presentation to the interpreting physician. Exercise discretion and judgment in the performance of sonographic and/or other diagnostic services. Demonstrate appropriate communication skills with patients and colleagues. Act in a professional and ethical manner. Provide patient education related to medical ultrasound and/or other diagnostic vascular techniques, and promote principles of good health. A large part of what we do deals with obstetrics. Here is an ultrasound of a first trimester fetus. We utilize scanning phantoms for many of our lab competencies. Here we are scanning an obstetrical phantom. Ultrasound is also used for viewing the organs of the abdomen. This is a sonogram of the right lobe of the liver on one of our students. Our program calls for students to scan one another for certain studies. A student can volunteer to be scanned. Our students also have the option of not being scanned. We do not scan other students for certain exams and thus rely on phantoms for these clinical competencies. Ultrasound is used to image vessels that carry blood from the heart and back to the heart. This image is of the vertebral artery and its Doppler waveform. This is an image of the common carotid artery. Ultrasound is also very useful in imaging the breast, as is seen in the following image. This is an image of our breast phantom. Ultrasounds that are used to image the adult and pediatric heart are called echocardiograms. The following image is that of the adult heart using color ultrasound. This is an image of the adult heart. Ultrasound can also image the brain of the newborn. As a rule, ultrasound cannot penetrate bone, but the newborn skull has soft spots, fontanelles, that also allow us to scan the brain. This is an image of a newborn's brain. Invasive procedures. Sonographers often are involved in invasive procedures in which pieces of organs or masses are extracted via needles so tissue specimens can be analyzed under a microscope. Ultrasound is quite often used as a guidance imaging method in order to see where a needle is placed. Sonographers play an important role in invasive procedures. What is sonography? The process involves placing a small device called a transducer against the patient's skin near the body part to be imaged. The transducer works like a loudspeaker and a microphone because it can both transmit and receive sound. What does a sonographer do? What does a sonographer do? A diagnostic medical sonographer is a highly skilled professional who uses specialized equipment to create images of structures inside the human body that are used by physicians to make a medical diagnosis. There are several areas of specialization in the field of sonography: abdomen, evaluation of the soft tissues, blood vessels, and organs of the abdominal cavities. For example, liver, spleen, urinary tract, pancreas. Breast, frequently used to evaluate breast abnormalities that are found with screening or diagnostic mammography. Obstetrics, gynecology, evaluation of the female reproductive system. Vascular technology, evaluation and analysis of hemodynamics, blood flow, of peripheral and abdominal blood vessels. Neurosonography, evaluation of the brain and spinal cord. Ophthalmology, evaluation of the eye, including orbital structures and muscles. Echocardiography, evaluation of the anatomy and hemodynamics, blood flow of the heart, its valves, and related blood vessels. Professional responsibilities: providing an oral or written summary of the technical findings to the physician for medical diagnosis, providing quality patient care, collaborating with physicians and other members of the healthcare team, obtaining and recording an accurate patient history, performing diagnostic procedures and obtaining diagnostic images, analyzing technical information, using independent judgment and recognizing the need to extend the scope to the procedure according to the diagnostic findings. Technical standards: lift more than 50 pounds routinely, push and pull routinely, bend and stoop routinely, have full use of both hands, wrists, and shoulders, distinguish audible sounds, adequately view sonograms including color distinctions, work standing on their feet 80% of the time, interact compassionately and effectively with the sick or injured, assist patient on and off examining tables, communicate effectively with patients and other healthcare professionals, organize and accurately perform the individual steps in a sonographic procedure in the proper sequence. What is required to be a diagnostic medical sonographer? A knowledge of pathology and physiology, human anatomy and physiology, good analytical and problem-solving skills, good interpersonal skills, compassion, high degree of personal integrity and professionalism. Our skills laboratory plays a vital role in the educational process. Note, the uniform colors for each sonography program is Associate's General Program, wine, Vascular Sonography, eggplant, and Adult Cardiac Sonography, green. This image shows a phantom demonstration of a transesophageal echocardiogram, which is utilized for imaging the adult heart. What are the salaries for sonographers? Around $65,560 per year. The average salary for a diagnostic medical sonographer in Florida is around $65,560 per year. There are many job functions and job settings for sonographer. Educational goals for sonography programs. The overall objective of the DMS program. Program goals. Our graduates are able to perform the following: obtain, review, and integrate pertinent patient history and supporting clinical data to facilitate optimum diagnostic results. Perform appropriate procedures and record anatomic, pathologic, and/or physiologic data for interpretation by a physician. Record, analyze, and process diagnostic data and other pertinent observations. made during the procedure for presentation to the interpreting physician. Exercise discretion and judgment in the performance of sonographic and/or other diagnostic services. Act in a professional and ethical manner. Provide patient education related to medical ultrasound and/or other diagnostic tests and promote principles of good health. Program goals of minimum expectations for our graduates. To prepare competent entry-level general sonographers in the cognitive, knowledge, psychomotor, skills, and affective behavior learning domains. The goals of the programs: to prepare competent entry-level general sonographers in the cognitive, knowledge, psychomotor, skills, and affective behavior learning domains. For accepted students, Diagnostic Medical Sonography, admission requirements DMS students. For accepted students only, AIDS 500 certificate, CPR certification, FDLE background check, technical performance standards. Liability insurance, immunization requirements. Eastern Florida State College, Diagnostic Medical Sonography programs. The skill set graduating students provide to the healthcare community. Sonographers and vascular technologists can choose to work in clinics, hospitals, private practice physician office, public health facilities, laboratories, and other medical settings performing examinations in their areas of specialization. Career advancement opportunities exist in education, administration, research, and in commercial companies as education and application specialists, sales representatives, technical advisors, etc. An associate in science degree is the standard. Top 10 jobs with an associate in science degree. 1. Dental hygienist. 2. Diagnostic medical sonographer. 3. Respiratory therapist. 4. Radiologic technologist. 5. Occupational therapy assistant. 6. Physical therapist assistant. 7. Cardiovascular technologist. 8. Licensed nurse. 9. Surgical technologist. 10. Massage therapist. Credentialing. Taking a test to show that you have the ability to perform competent diagnostic tests on humans. You may be asked to take many tests. RDMS, the American Registry for Diagnostic Medical Sonography. SBI, Sonography Principles and Instrumentation. Specialty exam, AB, OBGYN, BR, RVT, RDCS, RDMS.org. CCI, Cardiovascular Credentialing International, cci-online.org. ARRTS, American Registry of Radiologic Technologists Sonography Primary, ARRT.org. Sonographers must possess the ability to emphasize with a patient while remaining focused on the completion of the examination. A strong background in anatomy and physiology, excellent communication skills, problem solving and critical thinking skills, ability to work independently and as part of a team. Characteristics needed to be a sonographer: leadership and organizational skills, people skills, patience, flexibility, compassion, problem-solving skills, a sense of humor, the ability to stay calm in a crisis. What does it take to be a successful ultrasound student? Be sure to speak up so that you can have as much hands-on time as possible. Be ready to take criticism, sometimes harsh, at something that you may be proud of. Be ready to spend many hours every night and weekends studying material for your courses. Be sure your family and friends are ready to support your endeavor. Be ready to adapt. Be flexible with each new clinical internship, clinical assignment. Be ready to consider all the time involved, including drive, class, and study time. Be ready to practice your scanning skills. The techniques to be successful clinically may be more difficult to master than the classwork. Be sure to be very patient with yourself and others. Be sure to have a high level of motivation and self-direction. Be ready for a rigorous, challenging program. Ask yourself, am I ready for this challenge? Do I have the initiative to strive for excellence? Ultrasound applications. Obstetrics. Obstetrics. Abdomen. Abdomen. Abdomen abnormal. This is an image of an adult pancreas. Breast. 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 Vascular. Gynecology. Gynecology. Invasive procedures. Thyroid biopsy. Our vascular sonography ATC accepts students once a year. Our adult cardiac sonography ATC accepts students once a year. Frequently asked questions. What are the physical requirements for a career in healthcare? Standing for long periods of time, pushing and pulling machines, hearing, seeing, lifting patients, walking long distances. Do you need good communication skills for this program? Hearing, listening, following directions, people skills, accepting criticism, communicating with doctors and other healthcare professionals. What are the requirements needed in order to enter into the clinical portion of the educational program? Background check, liability insurance, drug testing, CPR, health clearance, uniforms, self-check, tattoos and piercings. Problems with a background check? Pre-application review. RDMS will conduct a pre-application review for individuals who wish to determine the impact of a previous criminal proceeding on their eligibility to apply for RDMS certification. Criminal proceedings include, but are not limited to, conviction or pleas of guilty, nolo contendere, to any crime, or when a finding of guilt is made or returned in a criminal proceeding, but the adjudication of guilt is withheld, deferred, not entered, or the sentence is suspended or stayed, including pre-trial diversion programs. For more information regarding the pre-application review process or start the process, download the RDMS pre-application request form. The pre-application review process is recommended for individuals who are not yet ready to apply for examination. Individuals who have already completed a program and are ready to apply should simply respond to the questions on the RDMS examination application relating to violation matters and provide the requested documentation. Dress policy. Uniforms in the classroom, uniforms at the clinical sites. Tattoos are allowed, but be discreet. Piercings should be kept to a minimum. Do I need to drive to be in this healthcare program? You must be able to get to off-site clinical locations. I had a legal issue several years back. Can I still enroll in the health career of my choice? ANS. You will need to check with your registry or licensing board to see if you would be eligible to sit for your exams before you enter into any program. Run a certified background check on yourself. Need to speak with a health science advisor? Contact healthscience@easternflorida.edu. Start your career in diagnostic medical sonography. Contact a health science advisor. Post-test. A mini essay is required for you to obtain the 5 points towards your application. Please complete the assignment on the next slide. Which sonography program are you applying to, and give your reasons why. Utilize what you have seen in this video as the basis for your answer. Answer in no more than 250 words. Email your essay to haldorfh@easternflorida.edu. In conclusion, love what you do, whatever it is.